Li-Fraumeni syndrome is a syndrome that's caused by a germline mutation in the TP53 gene and is associated with increased risk of certain kinds of cancers early in the life of the affected person.
So the core malignancies of Li-Fraumeni syndrome include osteosarcoma, soft tissue sarcomas, breast cancer, tumors of the central nervous system, and adrenocortical carcinoma. And typically these occur at a younger age compared to what we would see in the general population.
We recently published a case report for a patient with a history of jaw osteosarcoma and Li-Fraumeni syndrome.
This patient was in their 20s, also developed papillary thyroid cancer, which has been described and loosely linked with Li-Fraumeni syndrome, but also developed and was diagnosed with pituitary Cushing's, which is not classically associated with Li-Fraumeni syndrome. And to our knowledge, this was the first case that describes this relationship.
So our patient had been undergoing surveillance for their previously diagnosed osteosarcoma of the jaw. They were found to have thyroid nodules. These were found to contain papillary thyroid cancer, as well as a cellular mass. And this one, through biochemical testing, was confirmed to be a pituitary corticotroph adenoma, and this was also later resected.
In this patient, it required multidisciplinary approach to care in order to provide the most effective treatment course. And so in diagnosis and treatment for the thyroid cancer, it involved endocrinology care along with the care of endocrine surgeons, as well as with the pituitary condition, it involved a coordinated care with neurosurgery. And then when the patient later developed adrenocortical carcinoma, this required another multidisciplinary approach to care involving endocrinology, as well as surgery and medical oncology.
So in our particular patient, we did describe thyroid cancer, which traditionally has not been a core malignancy of Li-Fraumeni syndrome, but more and more data that comes out shows that it should be part of the surveillance that's recommended for these patients. This may lead to earlier tumor detection, better and less invasive treatment options, and better outcomes. Additionally, although not very commonly seen, we might be able to actually diagnose new patients with Li-Fraumeni syndrome that might present with an otherwise unremarkable thyroid cancer diagnosis, and genetic testing becoming more and more common and accessible. So my advice is to be aware of the different presentation that the patient may exhibit, and that may cross specialty lines and usually requires the presence of a multidisciplinary team to make sure that the patient has the best outcomes.
These patients are complex and have the potential for malignancy of many different organs and involvement with many different organ systems. So it's very important to be as part of a care team working together to take care of these patients.